We've paused the beginning of our webinar because people are still joining and wanted to make certain as many people had access before we began the presentation. As you're coming in, we'd like to say thank you for joining us for this webinar, this important update on the Public Act 2146. This will continue to add information that we shared with you about 2 weeks ago as we learned about reopening schools in the 21-22 school year. So we have people that are continuing to come in. I want to respect everyone's time. The meeting is being recorded. At the end of this recording, you will see there is a special email address that has been created so you can type in and send your questions as we continue to learn about the opening of schools in the 21-22 school year. At this time, I'd like to start, although people are still coming in. I want to respect everyone's time and I want to be able to provide as much information as possible. During our last meeting, we discussed that what are some of the parameters for opening schools in the 21-22 school year, and we shared that with everyone, explicitly sharing that as updates would continue to come in, and we suspected that there could be 1 or 2 additional bits of information that would come in over time, that we would share that with everyone so we are clear and we have a better understanding of what this new school year will bring for us. In addition to the meeting being recorded, we also have the meeting being translated, and it will be, you can ask your questions in Spanish and Albanian and we will respond to you. And if there are any other languages that you would like for us to respond, we can also make the responses available, and we will share that email at the very end of this presentation. With me today are several members of my executive team and senior cabinet, and also we are pleased and honored to have representatives from our Waterbury Health Department. So we want to thank you for being here with us. And we are going to start by telling you a little bit about what has changed since the last time that we met. And the Public Act 21-46 has certainly brought about a little revision and something that was very different from our last conversation, and I want to share that with you. I want to make certain that everyone knows that we are ready to begin this new school year with schools being safe and keeping everyone healthy as we open schools during this next phase of the pandemic, but very important to us, this next phase when we get to receive our students 100% in person. Schools will be cleaned and disinfected daily. Unvaccinated students have the option to be screened for COVID-19 daily. This starts in September for us. Masks and hand sanitizer is available at all schools. Vaccines are now available for students aged 12 and older. Masks will be worn inside the building. This is a mandate by students, and staff must wear masks. And students will continue to be distanced from one another as far as feasible in all settings. So we're going to start off by presenting an overview of what occurred the last time that we met. During our webinar, it was very clear that the directions that we received were that we were not going to be able to provide any kind of remote learning for the 21-22 school year. As a matter of fact, it was very specifically stated that the way that we provided virtual could no longer exist in the 21-22 school year, and that we anticipated that we were going to be able to work on a virtual model for the 22-23 school year for high school students only. And so when this information was presented to you, there was no option for remote learning in all of Connecticut. That has changed. And so I'd like to discuss with you what has changed about it. The state law guidance was amended on June 23rd, and the Connecticut State Department of Education guidance was sent out on July 15th, the one that originally had the information about no online learning, no remote learning occurring. So the law was amended, As the law was amended, we were specifically told that there would be no virtual snow days for the 21-22 school year. That is still correct. And that there was going to be no option for virtual learning as experienced in 2021. That is still correct. There is no option for full remote learning. Even as we're presenting this information, that option, the no full remote learning as experienced in 2021 is still correct. We will share what has changed, however, as the law was amended. The state law and guidance, and this includes the new amendment, accommodations for remote learning only can be provided when someone is isolated or in quarantine. When there's a localized outbreak, those two scenarios we're very familiar with because we will operate those exactly as we did last year. The third one is different. For vulnerable family members, there could be an option for online or remote learning for vulnerable family members, or a clause that will allow us to make some accommodations for some kind of remote ongoing learning if there's a vulnerable family member. And the fourth would be Homebound, which addresses individual accommodations for students. So let's talk about isolation and quarantine. And perhaps one of the members of our team will take that one.
Sure, I can jump in, Dr. Ruffin. Good evening, everyone. My name is Darren Schwartz. I'm the Chief Academic Officer. Isolated and quarantined students are students who are mandated to isolate or quarantine because either they are positive or a close contact. Students that are isolated or quarantined will be required to abide by district technology guidelines. They will be expected to log into their class and utilize all materials in Google Classroom. That would include anything from assignments that are in Google Classroom and including Google Meets. Students will be expected to follow all timelines and due dates of their class regardless of the quarantine status. So, and Will, maybe you could jump in and talk about how many days a student would be quarantined for in the upcoming year, and maybe some of the changes the public can expect in regards to last year, where whole schools and whole classrooms were shut down, which still could be an option for the upcoming year, but probably much less frequently than what the community is used to.
Yeah, sure, Darren, thank you. Talk about distance and quarantine. Students in the schools must maintain at least 3 feet of physical distance in classrooms when feasible, with available space and students being masked. This 3-foot rule applies to student in a classroom setting only. They must maintain at least 6 feet of distance in all other settings, and student to staff and staff to staff must also maintain a 6-foot distance. We implement these distances to the extent possible as part of a layered mitigation strategy in all areas to control outbreaks. But we're also looking at cohorting where possible, where we can add an additional layer of mitigation where kids will travel in groups and we can easily identify the students in case there is an outbreak. Schools are still going to have isolation rooms. Students seated at least 3 feet apart where possible from another student who has been diagnosed with COVID-19 does not have to quarantine as long as they remain asymptomatic and masks were used. The emphasis on identification of individual students this year versus of individual students of close contacts versus exclusion of entire classroom, where in the past where we would have a COVID case, we would flip the whole classroom. Now we're going to just kind of really do our due diligence, do an investigation, and see which kids were could be determined as a close contact, and then go from there instead of flipping the entire classroom. Each school or district building will maximize the social distancing by reconfiguring available space. We'll make sure that students and staff try to avoid sharing of materials as much as possible. And if they do have to share, we ask that they limit where possible in the classrooms of material sharing. We're asking that they arrange furniture so students' desks face all in the same direction. And we kindly ask that we provide frequent reminders for students and staff to respect distancing in the schools. So quarantine guidelines moving forward will be positive individuals will have to quarantine for 14 days. Close contacts will also quarantine for 14 days from date of contact of a positive. People who are fully vaccinated do not have COVID-19 symptoms do not need to quarantine or get tested after exposure to someone with COVID-19. These are new CSD, Department of Public Health guidelines. We are working on a new directive. More information will be forthcoming from the mayor's office and the health department regarding updated guidance. The guidelines and communication protocol for staff and members is, they will, once we've identified a student as positive, they will notify the school nurse. The school nurse will notify central office. Central office will help them perform the investigation, and we will make sure that parents are notified properly and timely in the school community versus various communication methods while maintaining confidentiality.
Thank you. Well, some new updates there, specifically guidance. This isn't just Waterbury creating this guidance. This is statewide, and so we appreciate you updating us on that. So some changes there for the community, but you heard from Mr. Zuda that 14 days a student could be isolated or quarantined, and that student would continue to follow their class schedule and continue to meet course expectations logging into the course. We anticipate much less students being on the camera compared to last year, where we had some classes where 50% of the class was out, 50% of the class was in, where that might be down to 1 or 2 students at most per class if they are positive or close contact. We've also experienced localized outbreaks. We've done this before in the past, as mentioned. Dr. Ruffin works very closely with the health department to determine, based on several factors, including the number of cases, exposure, and the size and physical layout of the schools in question when deciding is a localized outbreak. Should it be determined that the school itself, a classroom itself, and/or the district itself should go to full remote learning, there is still a clause to allow this to happen in conjunction with the City of Waterbury, the Waterbury Director of Public Health, school medical advisors will all be working in collaboration with one another if the data suggests it.
So let's talk a little bit about the term vulnerable family members. This is a category that did not exist previously. We did not receive significant guidance in that. This is some way that the law has been amended with a better understanding from school districts. So family members in the same household. If a student's family member living in a household is experiencing extenuating circumstances related to health, that could be mitigated through a remote learning experience, then the student will be considered for possible ongoing remote learning. Now, I want to repeat that because it's a mouthful, and we will have members of the team here to explain what extenuating circumstances are. So if a student's family member living in a household is experiencing extenuating circumstances related to health that could be mitigated through a remote learning experience, the student may be considered for some kind of remote learning. The second one is documentation of health-related extenuating circumstances necessitating participation in remote learning is required. So we would need that documentation. We would only be able to accept it if it's medical documentation. It's been issued and signed by a licensed medical practitioner. And if that is provided to us, we can consider this as a consideration for possible ongoing remote learning. Documentation of extenuating circumstances may include evidence of ongoing treatment by a healthcare provider of issues related to the health of a member of a student's immediate household that may be significantly impacted by potential exposure to COVID-19 and which could be mitigated by the student's participation in remote learning. And if those considerations are made, and if the student is allowed to have remote learning, the student is required to be a resident of Waterbury, Connecticut. The students, if accepted, must stay remote for the entire marking period, and a team of educational and medical professionals will review requests and documentation after each marking period. Students under 12 years of age are required to be supervised by an adult during school hours to participate in the program. In other words, if a student does qualify for remote, an adult would need to supervise the student's learning from home in order for the student to be eligible and continue in any kind of remote learning. And so with us from the health department, we have members of the health department who can help us best understand what is an extenuating circumstance.
Good evening, everyone. I'm Aisling. I'm the new Director of Health for the City of Waterbury, and I'm hoping to help us all understand the extenuating circumstances. As the previous slide indicated, those circumstances should be documented by a physician. These are circumstances that go beyond a moderate or minimal level of risk to the family and indicate that the presence of that child in the school causes undue burden to the family to protect people who are at home who may be having immunocompromised status and at greater risk. Within that context, however, I do want to point out that the research from the past year and a half has proven that school is actually one of the safest places for people to be because of the level and the number of strategies that we have in place to control infection within the controlled setting of a school. So it is with that caveat that I want to convey that this direction has been given by the state as far as extenuating circumstances, but also with the understanding that being in school is a safe place from an infection control standpoint for children to be, as compared to being out in the community or in a private care setting where maybe they're staying with a babysitter. I just want to reiterate the importance of having that structured approach to infection control that is assured by the school environment. You walk into a school and immediately are confronted with rules, and those rules are there to protect the folks who are in the school staff, faculty, and students. So regular hand washing is a group activity. Use of masks is reinforced by everyone wearing masks. You will be challenged if you take off your mask, whereas in the community, we don't have that level of assurance. We also can maintain social distancing through very prescribed movement through the school. We can modulate the access to the food services or cafeteria, whereas in the community, we don't have that level of control. So I do want to reiterate that school is among the safest places for a person to be within the context of the current situation we're dealing with COVID. School is one of the safest places, and we have very few outbreaks within the school context when all of those layers of protection, the use of masks, the vaccination of people who are eligible to be vaccinated, the social distancing, the regular cleaning, both by the teacher who's in the classroom cleaning up after people and the regular custodial staff, are all layered on top of each other to protect our children.
So we'll talk a little bit more Thank you very much, Aislinn. And we'll talk a little bit more about some other considerations as well. I know that several people have questions and we want to answer those. That's why I asked that at the end of the presentation, we will have an email address to answer all of your questions. I do believe that many of the questions that you're asking, we have it covered in this particular presentation. But for some reason, if there's still questions that exist, we want to answer them and we want to answer them all. So please bear with us as we continue. If we can have the next slide, we can talk a little bit more about so what is that next layer? How do we address it if our students need a homebound instruction, or they need instruction, or they need a special accommodation because of an existing IEP? And so I'll cover part of that, but we also have our Director of Pupil Services, as well as our the Chief Academic Officer and our Instructional Technology Director who can weigh in, and as well as our Director and our Assistant Superintendent for Human Capital. So a Waterbury student registered in the district schools, whether it's magnet or not, can apply for homebound instruction if they meet the following criteria and submit the information below. That would include a signed statement from the student's treating physician. It must be a medical doctor. It cannot be a doctor saying, I think the student should have, I think the student would be better served in a remote learning environment. That is not going to be accepted. It has to be a signed statement from a student's treating physician because of a medical issue, indicating the student is unable to attend school due to a verified medical reason, which is supported by documentation. Also, documentation of the extenuating circumstances may include evidence of ongoing treatment by a healthcare provider of issues related to the health of a student that may be significantly impacted by potential exposure to COVID-19, and which could be mitigated by the student's participation in homebound instruction. I want to be very explicit here to say that homebound is not the same as homeschool. There's a distinct difference between homebound and homeschool. Homebound, the student remains a student of Waterbury Public Schools with limited services that can still be provided while the student is still a student in Waterbury Public Schools. Homeschool is totally different, and we'll cover that in one of the other slides. So requirements for homebound instruction for a student with an individualized education plan, an IEP, or a 504 plan, we have recommendations and some examples to share with you. And Miguel, you might want to go into this.
Sure. Good evening, everyone. My name is Miguel Pabon. I'm the Director of Pupil Services, and I'd like to make a distinction here with regards to homebound. This is for students, as opposed to the previous slides that talked about a family member. So if the student is having the health issues, the homebound instruction is something that could be pursued by the family. And like the reference said in the previous slide, you would need to meet the criteria similar to getting documentation from a doctor. In most cases, students who already have a medical concern or health concerns may already have a 504 plan or an IEP, and in those cases we would have a meeting to discuss how the supports and services will be implemented. Those will also be reflected on the IEP or 504. Students are required to maintain residency in Waterbury. I know there's been a few questions about magnet schools, and we will answer those a little bit later, but I think that there's a distinction. If you live in Waterbury, we're talking about the students who live in Waterbury. And so for this homebound piece, there is an application that exists, and it existed pre-COVID. However, we are making some adjustments to this application, so it will be available later this week. The reason for the adjustment is that this instruction is or will be provided remotely. And In this next slide, I want to just point out two things. One of them is the amount of instruction that is provided to homebound students, and also the location or the place of homebound. The amount of instruction is indicated on the slide. If the child has a disability and is ages 3 to 5, that time will be determined by the PPT. Students who are in grades kindergarten through 6, typically it's no less than 1 hour per day or 5 hours per week. And typically those hours are provided after the school day. In grades 7 through 12, the time would be no less than 2 hours per day or 10 hours per week. Again, typically provided after the regular school day. The big distinction now with regards to homebound is the location. Prior to COVID, homebound instruction was provided in agreement with the family in a location, either in the home or a nearby mutual location that an adult would work with the student. For this coming year, homebound would be provided remotely. Therefore, using digital technology such as Google Meet, Google Classroom, and the like.
And these numbers, these hours, which are significantly less than what a student would typically receive in a school week, those are not set by Waterbury, but those are more regulations set by the state. Is that correct, Miguel?
Yeah, that is correct. And I want to just clarify that homebound instruction has been in place and with the same guidelines. These are the guidelines for home instruction.
So a family making a decision to possibly pursue homebound, there will be a packet available. We'll get to that later in the presentation, but just also realize that the amount of instruction is significantly less than what typically a student would receive, and what kind of impact is that going to have moving forward for a student has to be considered.
Correct.
So we also have a listing of what is not eligible. So non-eligibility to participate in a continuation of learning remotely. A student that would not qualify, if the family member living with the student has a rare and qualified extenuating circumstance and is eligible for a COVID-19 vaccination, then the remote learning option is not available. Keep in mind, there is a plan throughout the state of Connecticut to assure that everyone who is eligible for a COVID-19 vaccination gets one. If a family member has a medical reason for not receiving the vaccination, documentation from a licensed medical practitioner will be required. Also, the next bulleted point is that a preference for remote learning is not considered an extenuating circumstance. I got quite a few questions from parents and from students saying, I really like the online learning platform. Why can't I still have it? Well, according to the law, the one that I shared with you about 2 weeks ago, and what I'm still sharing with you as it was revised, is the online learning, the virtual, what we would have called a virtual academy, does not exist for the 21-22 school year. We are in Waterbury pursuing what that could look like in 2022 to 2023. It is allowable in 22-23 that we could create an innovative environment where remote learning can be an option for students who learn best in a virtual environment. That's not an option that we have during this school year. This school year, we're still in a pandemic. We're still mitigating unusual circumstances and working collectively to mitigate a virus that has not gone away. So the preference for remote learning is not considered an extenuating circumstance. Although we understand that for some students and for some families, they would probably like a virtual learning environment. We are not providing that this year. This year, the provisions are as a result of us working collectively to try to mitigate COVID-19. And of course, the non-eligible student if the student does not reside in Waterbury, that student is not eligible. And this is not, students that attend our magnet schools are students that attend a magnet school in Waterbury Public Schools. But a student who resides in another county or another city and just wishes to take part in what I just described and what my staff and I just described, because they live in another area that may not offer some of the options that we have or we will make available, cannot simply enroll in Waterbury Public Schools because they have an extenuating circumstance. This is only for Waterbury residents. So let's talk a little bit about what homeschooling is, because homeschooling is not homebound. And Mr. Schwartz, you could take that one if you'd like.
Sure. This is not recommended, and for a few reasons. My office and with my colleagues at central office collaborate with the building administration when homeschool packets do come in, and there are many disappointed parents that find out after they start homeschooling that once you start to homeschool, we are no longer obligated to provide services. Therefore, if your child requires special services, special education, occupational therapy, physical therapy, we no longer provide those services anymore. We are also, we are not allowed to also provide a Waterbury Public Schools diploma. Many parents call in the springtime asking, how do we get the diploma? We've been homeschooling our child for the last year or two, and we have to remind them, and we try to say this up front, that if you choose to homeschool, they are not graduating from the Waterbury Public Schools. There are accredited online opportunities for parents to take advantage of, usually at a cost out of their own pocket, if they choose to do that. But again, the long-term effects that might have on a student in terms of their ability to go on to higher education and or go on to a trade school may be impacted by homeschooling. And so, as Aisling said earlier, we know the impacts that being isolated from other students may have on particular children, and we don't recommend the homeschooling, but you do have the right. There is a law that does give you the option to homeschool. We are going to talk about this a little bit later in terms of how do you get a homeschool packet. I put the website on here in the link, but they will be available starting next week at your child's school. If you do choose to wish and to take that, you will be unenrolling your child from the Waterbury Public Schools, and especially in the upper grades, it does make it more difficult to give them those credits when they do, if you do choose to have them go back into our school or another school system as they re-enter. As Dr. Ruffin said earlier, I just also want to remind you that remote learning options will be coming, and we are developing them in Waterbury. We just are not allowed to do that this year. We'd love to have been able to devise that and give that to you, but we're not allowed by the law to provide that for you. And so even if you choose to homeschool your child for the upcoming year, if you choose to have them re-enter and apply for that, whatever that remote learning academy may look like, we can't promise that the credits that they achieved in that homeschool, based on what was delivered, what kind of grades they had, what kind of portfolio review would look like, that they would receive all those credits earned. They'd have to meet the criteria that we have for those credits. And so it's a tough decision that all parents are going to have to make. I would encourage parents to send their students to school this year.
So to continue as we're developing this, as we move forward, understand that if you are enrolled to receive any kind of remote learning, that it could affect some of the options that are offered in Waterbury Public Schools for the 21-22 school year. For instance, students may not be in classes with students from their home school, because as we move forward, we are trying to devise the best possible option for all of the children, and this may make it challenging to still have students with their own homeschool students in the same classroom. So it's It's simply a statement of fact that if a student is going to be receiving remote learning this year, that they may not be in the same class cohort as if they would be in their homeschool, attending schools in person. And that students currently enrolled in programs that we are very, very proud of. We're proud of our schools, our career pathways, and our programs, but it is possible that students enrolled in our SOAR program, our Adams or early college high may be unenrolled in that program because of which remote learning option would be available for them. And student applications would be reviewed if they wish to re-enroll in that program after they've returned to school in person.
And just to add on to that, Dr. Ruffin, and that's not to punish anyone, but it's just, it's really due to the fact that, for example, early college high, they have specific classes they have to take that just cannot be offered in a remote option for this year. And so those students wouldn't be able to continue with those courses that are required to be in those programs. So it's not a punishment. We'd be happy to review those students to re-enroll if they do come back to school. But unfortunately, they just wouldn't be able to meet the requirements in those programs.
Yeah, and I want to, and we can go to the next slide. I want to say, I say it repeatedly, and I want to share it again. We are still in a pandemic. I understand that people are really struggling to make decisions for their children, for their families, and I understand that very well. Waterbury Public Schools is not doing anything to harm you or to harm your children or to even make the decision harder for you. We're trying to clarify the information so that you can make the very best choice for your child, understanding that we are still in a pandemic. And, you know, in a pandemic that no one could have imagined would go into its second year, into its third school year. That's a very long time. So while I understand the frustration that parents may feel and guardians may feel, I totally understand that. But if you put it in the context of a pandemic, you have to realize that this is not in your control, and nor is it in mine. We are doing the best that we can to educate all of our children by providing a very safe environment for children to come back in person. And we understand if you have to make a different decision that would require or would necessitate some kind of remote learning, and we want to be clear on what those remote learning options are available in the 21-22 school year. So none of this is punitive. And while I understand people can sometimes get a little angry, please understand that anger won't solve the fact that we're all living in a pandemic and all of us are having to do things quite differently than we would ever have imagined doing, and certainly would not have imagined doing that in 3 consecutive school years. It affected our students in 2020. It affected our students in 2021, and it's going to affect our students in 2022. And that is most unusual. None of us on this call have experienced a pandemic that has affected our lives in such a way as COVID-19. Yet we're very, very concerned and on top of the situation as it applies to keeping everyone safe when they return in person. So the process for Homebound and for vulnerable family members will begin on Monday, August 23rd. The applications will be made available online and at all schools for Homebound and our vulnerable family exemptions. And Darren, you may want to continue with that one.
And school packets will also be available at schools at that time. Thank you to Adela and your staff. You've translated that information, and we're going to make some time. We'll talk about sometimes that if you have parents, friends, family, if you don't feel like you have a strong grasp on the English language, we're going to make those packets available to you, and we'll work with the bilingual office to get you support on filling out those exemptions if need be. We will need that packet fully completed and delivered to the school the child attends. The school will do a thorough review of that packet. They will send it to a team that consists of educators and health professionals to be able to review those packets. A determination will be made within 10 days of the submission. We will process them as quickly as possible. I want to reiterate what Dr. Ruffin said. I have two school-age children who I'm also sending off to school in the fall. Share the sentiments that many of you have communicated in either the chat or just from being in the community. I live in Waterbury as well, and I think that it's a difficult decision as a parent for sure, and we're going to do everything we can to support students. I will say this: if it helps, many of us on this call, and feel free to jump in if you were there, that many of us walked through summer school this summer with classes that were quite large. I mean, they were bigger than even last year, and I think we don't give our students enough credit when we don't think that they can keep the mask on. I think the students are more resilient than the adults actually. We actually didn't have, I don't think, a single case in the summer where students weren't abiding by the mandate of the mask. And I just think this is becoming right now a new normal for many of our students. It doesn't mean that some students won't struggle with it. For sure that will happen, and we'll have protocols in place for when students forget masks or refuse to wear the mask. But this is a decision. It's a family decision. It's a decision that you need to make with all the detail and data that we provided today. Just know that we're also abiding by the law, and again, we have full intention to take advantage of all remote options when the law allows us to. But as of right now, these are the options provided to us and for our community, made available by the legislators. And so we will do our best to comply with that and to also provide a safe learning environment. And Matt, I know you were out there in the schools this summer. I'm not sure if you want to jump in as well.
Yeah, just briefly, I would share that for sure we had over 400 students in our high school credit program at WAMS, and excellent attendance, excellent adherence to all the guidelines, well run by our administrators and teachers, and students were very successful. Obviously, as we've said repeatedly on this call, it's an evolving situation that we all need to keep our eyes on what's happening, but the state guidance gives us pretty clear directives that the best we can do here is really make sure we adhere to those guidelines that have been successful, not just in summer school, but in many other places, to really push to get all of our students back into our classrooms. And in those very, very rare cases where that seems like that's not possible, and we've got the guidelines here to follow. But the summer really demonstrated as a sort of preview that there's a lot of really good stuff that we can do with those guidelines to getting students back into school, back into the best instructional outcomes that we hope to see them.
And at this time, we did get some questions about mask wearing and asthma, and I'm not sure if Ace Thing wants to jump in with that, but as of right now, it's our understanding that students are required to wear the masks. And there were some questions about if a student comes in contact with somebody outside of the school environment that is a positive case, how do we actually know? And I know that that contact tracing sometimes seems difficult to understand for outside constituents. And so do you want to just talk very briefly about the mask and the mask mandate and how efficient that contact tracing actually is?
Be happy to. We have a very robust contact tracing program in the city. It's run here through the health department. If a person turns up positive on the report that we receive from the state, then our contact tracers contact that person, and they work backwards from all of the potential exposures that person may have had themselves and other people they may have exposed, to assure that we're closing the circle and making sure that we're offering testing and treatment to anybody who may have been exposed and who may be vulnerable to have caught COVID. As far as masks are one of our primary strategies for protecting children. We know that kids have gotten used to wearing masks and they're not that uncomfortable with wearing masks in the school setting because it's that kind of groupthink. We are supportive of parents, promoting mask use on a regular basis whenever you're out in public, just to get kids used to getting ready for school and getting into habitual mask wearing, understanding that the summer has been different And getting back to school is going to be a whole new series of behaviors for our kids. But kids did really well with wearing masks last year. And I think that we were able to enjoy certain freedoms at the beginning of this summer because we did so well managing infection in the schools last year. Everybody did a great job with hand washing, did a great job with social distancing, did a great job getting tested if they were starting to have symptoms, or staying home if they had symptoms before the start of school. Like in the morning, you don't feel good, you've got a little cough, little something going on, feel like you've got a fever coming on, stay home. So having parents have a hand in cooperating and helping us to identify kids before they come to school and keep them home if they are sick is a critical part of this strategy. I do want to mention that we are going to have regular screening testing available this year in the schools, and that's another layer of prevention and protection for your children. So helping kids understand that participating in voluntary screening testing at school is a way for us to minimize the number of absences from schools for parents. The less time you have to take off from work because you're home with a child that's been quarantined. I think that it's an opportunity for us to also have a finger on the pulse of what's going on with COVID in the schools. Kids who are not able to be vaccinated are the ones that are going to be tested. So it's a good pool of people for us to be watching to give us an idea of what COVID is doing in the community. And it is testing for COVID and the variants that are circulating right now. So it is a way of testing for Delta variant, just like you would get a test if you went to your local CVS and needed to get tested.
Thank you, Ace Thing. And just, you know, Dr. Ruffin talked about this on one of her slides. There is no such thing as logging on now on snow days. The state law does not allow us to count that as a day. That is not our decision, that's state law. And so I think I've seen a few things in the chat, which is, you know, people advocating for remote learning. I think that's, you know, keep advocating for it. We'll advocate it with you. But for right now, the law doesn't allow us to be able to provide students with remote learning options or a hybrid learning option as we did last year. It doesn't allow us. We're not going to break the law, and we'll wait for that law to change. But we are building the capacity of educators, professionals, administrators. We are redesigning leadership to be able to be ready for when that change does happen, because it will happen. It will come. Whether it's sooner than 2022, 2023, that's to be seen. But we are building the infrastructure to be able to meet that need. But that includes kids that are sick, kids that are home ill last year, kids that were in person that went home ill, could just turn on the computer and the video was on. That's not the case this year. The law does not allow us to be able to do that. Now, if students are quarantined, there is the law, as we said before, the isolation and quarantine is in the law to allow us for those students to receive instruction. Other than the isolation and quarantine, other than if there is a total district shutdown as determined by the health officials and the superintendent in the city. If the student is eligible for homebound through medical documentation, or if the student has a family member who is not eligible to receive the COVID vaccine, but does have a medical reason for why the student needs to have remote learning. Those are the four that were provided to us by the state. And so we can't emphasize that enough.
And we are not responding to questions in a chat. What we ask is that at the end of the presentation, if we have not answered all of your questions, that you please send them to the email address that's on the screen. And the reason why we ask that is because we want to answer your questions specifically. So I'm going to repeat some of the key points that we mentioned. We plan in Waterbury Public Schools to open school on August 30th in full in person. With the exception of a very small number of people that may qualify for the 4 exemptions that we presented earlier. And I'm going to go back to that slide if you don't mind. You know, I think it might have been the third slide that we presented. Those are 4 possible ways that someone could receive some kind of ongoing educational services in the form of remote learning. That's in the event that we have someone that contracts COVID. So if just like we did last year, if someone tests positive for COVID and needs to be quarantined, if they're not ill, obviously, if the child is ill, please don't make them have to log on. I mean, they're ill, they should get well, and we want them to get well. And then when they're better and they are no longer affected by COVID, they return to school, and the teacher, just like in regular time before we ever had a pandemic, would help them and to be able to continue with their educational services inside the school. But it would require quarantine. We've had a number of cases last year where children were quarantined and they were able to go home. They did not have any symptoms, and they felt that they could still continue to learn, and their parents wanted them to continue to learn. That remote option would be open for them. It will not look at all like it did this year. In a situation where someone has to be isolated or quarantined, it could be simply turning on your computer and being able to have access to what your teacher and the other students are doing inside the classroom, but it would not be the same as the teacher trying to teach half of the students online and the other half of students in person. That will not look like that this year. But obviously, isolation and quarantine would qualify a student to receive some kind of instruction remotely. The other one is if we had a localized outbreak. In the event that the COVID positives in Waterbury increase in such a manner that would require me, that would require the health department, our crisis management team, our entire team to make a decision that would require either a whole classroom or a whole school building or the whole district to go into temporary remote, because we would not discontinue educating all of our students. We have the capacity with everyone having computers to continue instruction. Then we would do that for a limited time until such time as the school could reopen again. That would be an example of a localized outbreak. The third would be if there is a vulnerable family member whereby the person that is seeking any kind of remote learning for a child would provide the required paperwork, as we had on this slide, and this presentation is going to be on our website. And so in the event that there is a vulnerable family member, there is a process whereby a parent can choose to apply so the child could be considered for a remote learning option. And that remote learning option would not look like at all what we did last year, but it could be an exemption that would allow the student to continue to receive some kind of instruction, though it would not look like it. It could be limited class offerings, and there would be no guarantee that the child could continue with their same cohort of students and the teacher. And then the fourth option is a homebound service. If a student will qualify either through an IEP or a 504 plan, this is very much individualized, and it would be based on the kinds of services that a student could receive remotely. It can be anywhere from a few hours a week to 1 to 2 hours during a school day, but usually after hours. And that could constitute a response to someone who is eligible for homebound services. All of those forms will be available. We make those available on August 23rd. There will be an entire team of people. As a matter of fact, there is a team of people right now working on what might that look like when or if people are asking for some kind of an exemption, how we could respond to you in a very quick manner. We want to be responsive. At the same time, we are also aware that the information that we're sharing with you this evening could change. We certainly did not have this information 2.5 weeks ago when we had our last webinar. So things changed, and what we are committed to is that we're going to bring you up-to-date information as we receive it. And when it changes, we're going to inform you of that in a timely manner Sometimes it takes a few days because we want to make certain that it doesn't change multiple times before we come back and speak with you, because we want you to be well informed and to make the very best decision that you can for your child, for your family. We understand these are indeed unprecedented times like no other. And keeping in mind that for 3 years now, 3 consecutive school year, part of a school year, this has affected our entire nation and the world. And we are cognizant of that. All of the resources that we're able to return to our students in the form of various funding sources, we are applying that to our schools. We're applying that to the teaching and learning environment to best meet the needs of your children. As we continue to learn more information, we are committed to come to you. We're going to present you with the most up-to-date information so that you can make the very best decisions possible. We're so excited about seeing your children on August 30th. And we're so excited about hearing and receiving feedback from you and responding to your emails. Again, if you will show the emails so that we can make sure everyone has it. It will also be posted on our website, and you can email us. There will be someone paying attention to this particular email address on a regular basis to respond to your questions in a timely manner. Could we please display that slide with the email addresses? I believe that most of the questions that were asked have been responded to, but sometimes because it's such an important decision that everyone has to make. You know, we're thinking things through in ways that we could not have imagined 16, 17 months ago. We're thinking about things we spend so much time in. How do we contact trace? How do we notify everyone? We want to be very open, and yet we understand that the enormous task and the number of people that are working to make sure that we communicate effectively to you, that we do so in a timely manner, that decisions are made consistently, becomes really challenging when you have a virus that you're contending with. And realizing that our schools are the safest place, and hearing that repeatedly from our health department, and knowing that while we did have COVID cases last year, we also understand that when you compare that to some of the other entities and other businesses, that our numbers were relatively low. But still, it's important, because when it affects your children, it's not something that you take lightly. The remote learning at waterbury.k12.ct.us is how you could direct all of your questions that you feel you need clarification, or you just want to ask it again so you can have a real person respond to it. You're more than welcome to do that. We expect that as our teachers return to the building, which will be next week. Our administrators returned this week, although some of them never really left. They worked throughout the summer. We expect our teachers to return next week for professional development. We will cover this and so much more with them. And we are so looking forward to our students returning in person on August 30th. And for any student that needs additional accommodations, that we are able to respond to you in a timely fashion, because you will have the information to request at least consideration for what your options are. You should be notified in a timely fashion so that you will know what your options are as we begin the 21-22 school year. I thank you very much for your time. I thank you for your commitment, your entrusting your children to Waterbury Public Schools. And I know together, if we could get through the pandemic last year, we will get through the pandemic this year, until one day we will no longer have the pandemic, but we will certainly have learned a lot of skills to mitigate any challenge that we could possibly face. So I thank you. I hope that you have a wonderful evening, and please do let us hear from you. We're going to keep this slide up so you can continue to jot it down. And if you need to send an email right now, you can do so, and someone from our staff will respond to you in a timely fashion.
I'll keep it up about 30 more seconds, and then And if it's then I would suggest that if it's a specific question about a specific case, without all of the documentation and everything, I have a feeling we might get a lot of specific case questions. Your best case is to fill out the application and submit it. And so I would urge you that if you have a specific case question, without having the entire documentation in front of us, that we won't be able to give you probably the answer you're looking for. And so your best bet would be to fill out the application and then allow us to provide you feedback in that case.